Hello, my name is Ron McCulloch and I'm a consultant podiatric surgeon specialising in Morton's Neuroma. In this particular video, I'm going to discuss preparation for your cryosurgery operation. And this video is going to be sent to all our patients so they'll be able to prepare and be confident that they've done all the right things prior to attending. Now, I'm also going to put this video on our YouTube channel, and it is important that people appreciate that things may change. So if you can, subscribe so that you'll be told of any updates or later videos that might involve a change in our protocol. This is unlikely in the immediate future, but the channel of course discusses all aspects of Morton's Neuroma, and that includes footwear choice, etc., which remains important even for people who have had cryosurgery, because obviously we want to make sure that all measures are taken to avoid any recurrence or perhaps occurrence in the other foot if that hasn't become involved, because there is some additional risk that if you suffer from Morton's neuroma in one foot, you may develop it in the other. And things like the right footwear are important. So do subscribe so you'll have that information on the latest shoes. So before I delve into the general points about preparation for cryosurgery for Morton's neuroma, I'll just quickly run over what happens so that people can feel comfortable, that they know what to expect. Fundamentally, when you come in, I will perform 2 injections. The first one will be done under ultrasound guidance, and this is called a nerve block, and fundamentally it targets a specific nerve, and by numbing that, the foot will remain numb for at least 6 hours, but often longer, and sometimes even 48, although that's less common. But that's great because it means that you're going to have very little post-operative pain, and most patients have very little pain. Then there's a second injection along the top of the foot, and that injection will then cover any nerves that might have been omitted by the first injection. Then we wait a while, you're thoroughly tested, and when appropriate, the cryoprobe is administered after your skin has obviously been prepped, and the process then starts. For those patients who are interested, there is a large screen with black and white image of the procedure. Some patients are fascinated by that and love to see it, and others would definitely not wish to see it and like to lie back and just listen to music, or we just have a chat. But once that procedure has been done, you'll then have a smallish dressing put on your foot, placed on your foot, and you can then wear relatively normal shoes, but this will be covered a little bit later. So getting on with some of the specific subject matter, what can you wear for the procedure? It's quite okay for you to wear normal clothing. The only thing is that we do like to have the lower leg exposed where there's no clothing over it. So if you're going to wear trousers, they need to be loose. Obviously a skirt is no problem at all. When you attend for the procedure, please do wear socks. It's not at all ideal to just have sandals on without socks, because when the dressing has been applied, we obviously want to make sure that it stays nice and clean. And then in terms of shoes, you can wear any reasonably loose-fitting shoe. A slip-on shoe is okay because you shouldn't be walking much afterwards anyway, or a loose trainer is absolutely fine. If you have a trainer that's a little bit tight, you can take the inner sole out, and that will often provide you with some additional space. So in terms of preparation, obviously we would like you to wash your feet. You don't have to use special antiseptics. Please just use good soap and water. Make sure you clean well between the toes and that you dry well between the toes. Also, just make sure you haven't got any abrasions or open wounds anywhere on your toes, because if that is significant and if there's any redness around it, then the procedure will probably be postponed because there'll be an increased risk of infection. It's important that you bring your normal medication, especially if you have asthma, and perhaps if it's triggered by anxiety, we'd want you to have your normal inhalers with you. Any other medication would have been discussed. In some cases, if you're using certain types of blood thinners, then we would ask you to abstain, but that will all be explained during the initial assessment that you have with me. In terms of going home, it's important that you have arranged transport. What you need to do is, when you leave the clinic, sit on the back seat of the car with your foot up to travel home. You definitely can't use public transport. It's also a good idea to have somebody with you. If you attend on your own, especially if you're a little bit anxious, then going home in a taxi with a driver you don't know isn't always as helpful, and so it's better to have a friend or a family relative who can accompany you for the procedure. An important point to bear in mind is that your foot will be numb for at least 6 hours and possibly longer. During that time you can walk on your foot, so it's not so numb that you can't actually walk, but it will feel odd. It's like having a completely numb foot underneath, as if you've been sitting on it for a while and you've lost that sensation. And so as a consequence, walking isn't easy. You wouldn't want to walk too far because you haven't got protective sensation. So for example, if you stood on something, you wouldn't know. So until the anaesthetic is worn off, you just need to take it easy, sit with your foot elevated. If you have it done during the day, by the next morning, the anaesthetic is usually worn off. So another common question is obviously that patients will ask what they can or can't do following their procedure. Now, this isn't a straightforward scenario because patients differ. You get some people who have virtually no pain from the moment it's done, who quite happily within a few weeks are out doing sports and being more active. And then you get also patients who are hypersensitive, who have more tenderness, where it takes longer to heal. And so I always say, listen to your body, do as much or as little as you feel you can after that initial 2-3 days of definite rest. And rest doesn't mean being in bed. You can still work from home, but you wouldn't want to be doing extended walking for the first 3 days following the procedure. So in terms of things like returning to sporting activity, I probably will have a specific conversation depending on the patient's situation. Broadly speaking, obviously, if you're doing a high impact sport with lots of pressure on the forefoot, the return will be longer than if you enjoy going to the gym and swimming, which you can do a few days after the procedure. So it's probably too broad in this video to talk about all the specifics regarding sports, and I may do that as a separate video, or that will be answered individually when patients attend the centre. So obviously patients will very quickly ask, well, how painful is this? In terms of the actual procedure, the injections are a bit like dental injections. I don't think they're terrible. I've had the blocks myself. I think they're very manageable, but obviously there is a little bit of a stinging sensation. We can apply creams and various medications to reduce that, although it's mainly the fluid entering the foot that you feel, so they're not that effective, to be honest. We also do have gas and air, but that is really only used for patients who are perhaps super sensitive or very anxious, and most patients just don't need that. But occasionally we'll have somebody who appreciates it, and then it's available within the practice. Another question that I'm sometimes asked is whether the patient will require crutches. You will not require crutches, generally speaking. There may be some exceptions where perhaps a person's gait is already compromised. We do have crutches in the practice. If I feel that somebody needs them, they're available. But just like special surgical shoes, they're just not required for the majority of patients because of its minimally invasive nature and the small dressing that we're able to apply. Another thing that will sometimes be asked is how much will my foot swell? What's normal? What's a normal appearance after the procedure? So basically there should be little to no swelling after the procedure. If there is obvious swelling, that's not normal and that's extremely uncommon. So if that happens, we appreciate a phone call so we can deal with that. But as I say, that is a rare event. Obviously redness generally wouldn't be apparent either. Because of the injection, you could get a little bruising around the area, particularly if you're sensitive to bruising, but again, that's not the norm. And then finally, as you're recovering, you will probably be wondering, when do I know whether the procedure has been successful? Now with cryosurgery, the recovery period is longer. It doesn't take a matter of days or even weeks. It takes about 3 months before we know whether the procedure has been successful or not. Now that doesn't mean it's going to take 3 months, and it certainly doesn't mean you're going to be in pain for 3 months. But some people have what we described the recovery as pendular, and some people, and a lot of patients, have ups and downs. And whilst there is a general trend of improvement, there can still be fluctuations within that. And some patients just take longer to turn a corner. So for that reason, we would generally recommend that we wait 3 months before making a decision about the effectiveness of the procedure.